Hi, I'm Dr. Hajar Mohammed Abdulhamid. I'm going to talk today about the obturation. What's the obturation? And mainly today, the second part of the obturation lecture. So we will talk today about the techniques of obturation. Techniques of obturation, how we do the obturation. There are several techniques. Each technique we will discuss it after a while. First thing during the preparation or the preparation for obturation, first thing we have to prepare the root canal. How we prepare the root canal. First thing, after cleaning and shaping, we have to be sure that our canal is cleaned and shaped to the optimal size and there is no any debris in the canal. So we have to do a very good irrigation with a good irrigant like sodium hypochlorite, chlorhexidine. We discussed the irrigation previously. And then we dry the our canals with paper point. What's the color of the paper point? The color of the paper point is white. So we have to dry the canals before obturation. We have to be sure that the canals is clean and irrigated and then dried enough. Second thing, we have to make sure that our master cone is fitted to the optimal length. So second thing, we have to make sure or take a good x-ray, make a very good x-ray to be sure that our master cone is fitted to the working length. Then prepare the sealer. So preparing the sealer. First thing, we have to mix the powder and liquid. We have two kinds of sealers, the powder and liquid sealers and the paste sealers. The paste sealers, there's no any problem in the paste sealer. It has one consistency, and when you just add the catalyst and base, you can mix immediately, and after mixing we get the proper consistency. But in case of the powder and liquid sealers, we have to do two tests to confirm that our test or our mixing is very good. First test is the drop test. What's the drop test? After mixing the cement on the spatula, the cement should not drop off the spatula edge in less than 10 to 12 seconds. What means this? After mixing, we take all the sealer on the glass slab on the spatula, and then we just bend the spatula 45 degrees and try the sealer to go down from the spatula. The drop test must the sealer must take 10 to 12 seconds to drop from the spatula. That means that our consistency is very good. The second test is the string out test. After mixing the powder and liquid, the spatula is raised slowly up. The cement should string out 1 inch, 2.5 centimeter before breakage. like this picture. This is the string out test. When we push the spatula up, there must be a very thin part, a very thin string of the sealer coming with the spatula up about 1 inch. That means that the consistency is very good. If the sealer is so hard or so soft, it will not go with up with the spatula. So we have to make a very good consistency like the string out test. Second thing, I told you before that we have to confirm that the getaberka is very good or fitted very good in the canals. So what's the meaning of fitting of the master cone? First thing, to reach the working length. Reach the working length. It's very important to reach the working length. That means that when we put the getaberka, like in this picture, when we put the getaberka here, we see that the master cone fit to the optimal working length from the reference point to the optimal length. The second thing, the same size like master apical file or less one size. What's the meaning of this? That means that if we have a master apical file 45, we take a cone, master cone 45 or 40. So we take the same size of the master apical file or less one size. Third thing, the apical portion of the root canal is almost fitted with the master apical file. That's called tuck back action. What's the meaning of these words? That means this apical third here, the apical third here, the cone must fit the root canal in the apical 1/3 very good. When we put the cone here and then we try to get out the cone, it makes like a tuck back action, a tuck. That means that it fits very good in the apical portion. So why we are saying the apical portion only? Because when we did a root canal before, when we was doing the cleaning and shaping, what we do in the cleaning and shaping, we do the flaring. Yes, do you remember? We have to do flaring to the root canal. So when we do flaring to the root canal, the coronal 2/3 of the root canal is oversized than the getaberka size. So we have to put accessory cones to fit the flaring what we did in the cleaning and shaping. But the most important thing, the apical 1/3, it must fit accurately to the master cone. Okay, then how we will test this? First thing, visually. How visually? When we put a cone, let's say an example. Now we have a root canal. The length of the root canal is 21. So when we take the getaberka, we just make a reference in the getaberka like this with a tweezer, with bending. We will discuss this later. So we make a mark here and then insert the cone. When we make a mark, the length must reach the master apical or the reference, our reference point. If this mark doesn't meet the reference point on the tooth, that means that there is something wrong. Maybe it's too big, maybe there is not enough cleaning and shaping in this part. So if our reference in the gataberka didn't reach the reference point on the tooth, so we have to arrange or redo the cleaning and shaping and just fit this length. Tactile sensation, second thing is the tactile sensation. Tactile sensation is like the tuck back action which we said before. We have to feel the tuck back action. Radiograph, like this picture here, we have to confirm by radiograph that the cones are reaching the working length, reaching the apex of the tooth, and the reference point is accurate. There is no any gataberka going out of the tooth or it's not short. So the tests is 3 tests: visual, tactile, sensation, and radiograph. The sealer. How we make delivery to the sealer? By 3 things. By gataberka point, by putting the gataberka on the sealer, and then we take the sealer with gataberka and then insert it to the paper point, the root canal. By K-file, and by lanthula. This is the lanthula. We just attach this lanthula. It looks like a spirals, and attach this lanthula to the low speed handpiece, and then we just take the sealer on the lanthula and put it in the canal. Or also the injectable one, like this. We can inject the sealer in the root canal. Obturation techniques. What is the techniques? Gataberka can be used by cold lateral condensation technique, chemically plasticized cold gataberka technique, warm gataberka technique, and then we will discuss each technique in details. This is the kind of obturation. We have to be sure that the gataberka or the master cone is fitted accurately in the accurate working length in the canal. Like this picture, look, this is a short gataberka until here. There is no any gataberka here, so this is a short obturation. Then it leads to a periapical infection here. Also, this is a short obturation leading a periapical infection here. Second picture here, there is a overextended gataberka, and it leads to a lesion under the tooth. Also here, there is an overextended gataberka from the root canal. Also here, there is an overextended gataberka, and here there is an underextended gataberka. So we have to confirm that our length and our master cone is fitted to the optimal working length. So here I want also to discuss another thing. When we just put the master cone here, like in this case, or like in this case, when we put the master cone here and we find that the master cone is short. What we can do in this case? Now, not short like this, that means that there is a very big problem in the cleaning and shaping. There is no flaring. Maybe there is ledges here. That's why the gatabarka didn't enter the root canal. But maybe like here, if we said before that the gatabarka must reach the optimal working length. If we put the gatabarka and we find that it didn't reach the working length, maybe it's less than the working length 1 milli or 2 milli, so we have to do one of the two things. First thing, we have to change the size of the gatabarka. Maybe if we have 45 gatabarka, we just shift to a smaller size, 40 gatabarka, and just see if it reached the working length. Or we do re-cleaning and shaping to the apical portion here to increase the size and to clean this part very good, and to increase the size to 45, and then put the master cone, 45 master cone again. This is the point if the gatabarka or the master cone is short. If it is long, like this case, that means that the master cone will enter the root canal over the working length. So in this case, we have two options. First option, we can take the bigger size. Here we take the lesser size or the smaller size. Here we take the bigger size of the gatabarka. Maybe if it is 45, we take 50. And then retest it, or we just cut the 1 milli or 2 milli of the gatabarka from the 45 size gatabarka, and then just ensure that it reached the full working length accurately. In this case, we have to just be sure. This is a very, very, very important step in obturation steps. The techniques. We have solid core techniques, a single core technique, or a lateral compaction. When we use the single cone technique, we can't use the single cone technique except in one step, which is when we are using a rotary files. When we are using a rotary files, the rotary files has their own size of gatabarka. So when we use a rotary file size 35, we have to get the gatabarka for this system of the rotary files to ensure that the cone fits all the parts of the root canal. We all know that the rotary files has different taper 4, taper 6. So the gatabarka which we fill the canal with is the same size and taper like the files. So the single cone technique is used only in case of rotary files or rotary technique or rotary obturating canals. In usual cases, or when we use a hand cleaning and shaping with regular hand files, we use the lateral compaction. Why? Because we are doing flaring to the apical 2/3 of the root, so we have to make a lateral compaction, and we will discuss it later. Soften core technique, the previous one is the solid core. Now the soften one divide into warm lateral compaction and warm vertical compaction, thermomechanical compaction, injectable gataberka and core carrier gataberka. First thing they called lateral condensation. Selection of master cone, like we said before, we have to select. This is the part which I was talking about previously. We have to bend the gataberka to the optimal working length and then insert the gataberka to the canal to the reference point. This is the reference point. Let's say that this gataberka is 22 in length. So when we put this gataberka in the canal, the our mark must reach the reference point on the tooth. That means that this is the accurate working length. If this part or if this mark didn't reach the reference point of the root, so we will do like I said before. If it is short, we have to do what I said, or if it is long, we have to just adjust the gataberka. This is the part which I was talking about. If it is too long, we can just cut with the scissors the excess 1 milli or 2 milli. So first thing, the selection of the master cone. Here we just adjust the length of the master cone and make the mark. Selection of obturating instruments, the spreaders and bloggers. What is the obturating instruments? We have two obturating instruments, spreaders and bloggers. What's the difference between the spreaders and bloggers? This is a spreader. This is a spreader. This is a finger spreader, and this is a hand spreader. And this is a blugger. This is a blugger, and this is a finger blugger. What's the difference between the spreader and blugger? The spreader here, if you see, the spreader here is pointed end. Here, pointed end. The blugger here is blunt end. So the spreader is used for lateral condensation and the blugger is used for vertical condensation. So this is the first difference between the spreader and blugger. So the spreader is pointed end, the blugger is flat end. The spreader is used for lateral condensation and the blugger is used for vertical condensation. And this is a finger spreader and this is a finger blugger. The finger spreader and blugger has the same colors and standardization like the files. That means that this blue one is size 30 compared to size 30 files and gataberka. So this is the instruments we are used. Some companies make the spreader and blugger like Mayfair in the same instrument. This is here a blugger and here a spreader. Here a spreader and here the other side is blugger with different sizes. Mixing the sealer. We talked about the mixing of the sealer in details. This is the lanthula. This is the mix of the sealer, the string out test. this when we take the sealer on the gataberka. Now, first thing in the technique, we just confirm the working length. Then we put the master cone to the working length. And then we enter the spreader. We said before the spreader has a pointed end. And it works for a lateral condensation. We just insert the spreader and make a lateral condensation to the gataberka. Why? First thing, to create space for the accessory gataberka, because the small size gataberka, the accessory gataberka, is so soft. So if we didn't make, or if we didn't create a space for the gataberka will bend. So we couldn't, or we can't insert the accessory gataberka to the root canal. So the spreader is very important to create a space and make a very good compaction. And make compaction, the second thing, make compaction vertical or lateral? Lateral compaction to the gataberka. And then we put the accessory one. Then we just redo it again and put the spreader, put another accessory until we fill all the coronal 2/3 of the root canal. Now, how we will select the size of the spreader? The size of the spreader must be shorter from the apical, or from the length of the cone, 2 to 3 millimeter. So when we insert it, it goes to less than the working length, 2 to 3 millimeters. Then we will select the spreader, maybe size 30, maybe size 35, and then we will use it in lateral condensation. Always there is a question here. Do we change the size of the spreader during lateral compaction? No. When we select a spreader, we just go with this spreader, or use this spreader until the end. We don't change the sizes of the spreaders. Here, this is the master cone. The master cone must fit the tack back action, must fit the apical 1/3 of the canal accurately. So the cone fitted the all the walls of the canal from the apical 1/3. And when we go up, we said that we put an accessory gataberka. This is the master cone, and this is the accessory gataberka. And the sealer was used. Why we are using the sealer? To fill the spaces. The first thing, sealer, fill the spaces between cones. Second thing, to adhere the cones to each other. Okay? Now this is the, look, this is the master cone, and this is the accessory canals, and this is the spreader, the finger spreader. What's the modification in lateral condensation techniques? First thing, when we have a case like this case, we have a tubular canal or blunderbuss canals, like here, open apex, like here, open apex. There is no cone or master cone or gataperca fits these cases or these two cases. So what we can do when we are obturating these cases? First modification, the inverted cone technique. What's the inverted cone technique? That means that we take the cone, our master cone, and we just cut the color coding and we inverted the thick part or the bigger part or the taper toward the apex and the thin part toward the crown. So we just invert the cone to fit the size of the apical part of the root. Maybe in this case we have to use cone size 80 maybe, and then try this to fit the apical part of the root. This technique is called the inverted cone technique. The other technique is the tailor-made cone technique. What's the tailor-made cone technique? We are customizing a gataperca. How we customize this gataperca? We take several 1, 2, 3, 4, or 5 gataperca and then heat it. And then between two glass slabs, we just roll it, start rolling it. It adheres to each other, and we gain a thicker one and a bigger one, taller one, like we need. So this is our cone, and then we have to take several ones of these cones and make a customized one to just meet the size of our canal. This technique is called tailor-made cone technique. Chemically plasticized technique. So we was talking about the cold lateral condensation technique, and this is the second chemically plasticized technique. What's the chemically plasticized technique? That means that a number of chemicals has the ability to soften the gataperca. We put the gataperca in a chemical, so the gataperca becomes soft. Like what? Like chloroform, but the chloroform is highly irritant and exhibit a carcinogenic and mutagenic properties. So they subside the chloroform with eucalyptus, xylene, halothane, and rectified white turpentine. These chemicals are less toxic and irritant, and they are not carcinogenic. So previously they was using the chloroform soften gataperca technique, and when we soften the gataperca in chloroform, we called it chloroperca. By 3 techniques. First technique is the John Calhoun technique. What's the Johnston-Calhoun technique? That means that the root canal is floated. We just inject the chloroform in the root canal, and then we put the gataperca, the master cone, in the root canal. But this technique is very irritant, and it pushes some of the chloroform to the periapical tissue, and it is very, very, very irritant. And then we use the regular lateral condensation, which we discussed before. The second thing is placement of master cone in a dappen dish filled with chloroform, and then soften the gataperca in the dappen dish, and then put the cone to the canal coated with the sealer to confirm the shape and size of the apical portion of the root canal. So this technique is very important. There was used before, but nowadays we are not using these types of soften gataberka techniques. This is the dapendish, which I was telling you. This is the dapendish, and this is a chloroform. We dip the gataberka in the chloroform, so this part will be softened, and then introduce this part of the gataberka to the root canal, and then it takes the same shape like this. Look, the same shape like the root canal because it's softened, and then we obturated like we said previously. The third technique is Nygaard Ospay technique. This method was made to reduce the shrinkage of final fitting gataberka and reduce the apical extrusion of toxic chloroform. And they made a mixture with a gataberka, Canada balsam, zinc oxide powder dissolved in chloroform, and then this create a paste, and they then inject this paste to the root canal. Gataberka dissolved in eucalyptol, and we said before, when the gataberka dissolved in chloroform, we call it chloroperka. Now, when the gataberka is dissolved in eucalyptol, we call it eucaperka. So, why we use this? Because it's less toxic than the chloroform. Disadvantages: highly irritated in the periapical tissue. The disadvantages of using the chemically plasticized technique as a total, and the shrinkage which occur after vaporization of the chemical. Third technique. Now we discuss the cold lateral technique, the first technique. The second technique is the chemically plasticized technique, and the third one is the worm gataberka technique. The worm gataberka technique is subdivided into two types: inside the root canal and outside the root canal. Inside the root canal, we use a warm lateral condensation, vertical compaction, thermomechanical compaction, and outside the root canal, Obtura 2, ultrafill system, and solid core carriers. And then we will discuss this in details now. The worm gataberka inside the root canal. First thing, the worm lateral condensation technique. We use a hot spreader. When we say lateral, then we use a spreader. When we say vertical, we use a blugger. Okay? So when we say worm lateral condensation, so we will use a hot worm, a hot lateral, then spreader. Okay? So in this technique, we use a hot spreader. We use two devices, Endotech or touch and heat. The Endotech 2, we can use the Endotech 2 as a lateral or vertical compaction. The Endotech combines the best of the two most popular obturation techniques, the thermoplasticized of warm vertical compaction and simplicity of the lateral compaction. So we can use, in case of Endotech, the vertical and lateral compaction. Advantages: less stresses, less shrinkage, and useful in C-shaped canal. So how this Endotac 2 works? We can attach the tip here. We can attach a plugger or a spreader here. It comes with it tips, spreaders and pluggers, and then we fit it here. And then when we put a bottom here, when we just put our finger on the bottom, it just heat the tip, and we can use it as a warm vertical or lateral compaction technique. The warm vertical condensation. How we do the warm vertical condensation? First thing, we have to just, like we said before, we have to select our spreader or plugger, and it has to be less than the working length by 2 to 3 millimeter. And then just test it. And then we put our master master cone here. We just choose a plugger and then heat the plugger and make a vertical compaction. Now it's not a lateral compaction. We make a vertical compaction because this plugger is heated. When we just push it on the gataberka and make a vertical compaction, some of the gataberka will attach to or stick to the plugger, and when we take out the plugger, it comes out, so the length here will decrease. Then put another plugger, just make a vertical compaction, put another plugger, and make a vertical compaction until we just fit or make a very good compaction to the apical third. And then we just take another cone and make a vertical compaction. Okay, that's the warm vertical compaction. The plugger here is heated, and then we make a vertical compaction to the cone. Why we are making a vertical compaction here? To gain the maximum compaction to the gataberka. Look here, the gataberka enters the lateral canals here during the vertical compaction. So it's very good technique. But when we use this technique, we have to be very sure that we have a very good apical stop here. If we don't have a very good apical stop here, the gataberka, when we make a vertical compaction, the gataberka will go out from the tooth. So we don't use this technique if we are not sure that there is a very, very good apical stop. Look here now. We can heat the gataberka like this, or we can use the device. The warm selection gataberka, a modified of the vertical compaction. Small warm pieces of gataberka are used. Now in this case, we just take a small pieces of gataberka and introduce it in the root canal. The gataberka pieces are warmed by passing over an alcohol flame. Others use solvent like we did before, or like we said before. System B, it's a very good system. Uses the principle of vertical compaction, but with improved methodology. Now this tip is a plugger. When we can use this device as a cold or heat vertical compaction. When we just hit the bottom here, it make heat to the tip and make we can use it as a warm vertical compaction. When we just remove our finger from the bottom, we can use it as a cold vertical compaction. There are several tips come with this system. and it make a softening to the getaberk. System B also come with this is like the system B, and this is the injectable getaberk. The temperature of system B is 200, and we just raise it to the 200 and then use it. Also, the thermoplasticized getaberka, like the Obtura. This is the Obtura. In this case, the system B and Obtura is in one system. Now there is a new system bringing the system B and the gun in the same system. So we use the system B for softening for making a vertical compaction, and then we fill this rest of the canal with the Obtura system. Now this is the injectable. We put the getaberka here, the pellets, and then we inject it. It comes softened from the tip. This is the thermomechanical compactor, like the quick fill. This are carriers, and these are inserted in a low speed handpiece, and it rotate at 8,000 to 20,000 RPM. This rotation makes heat, and the heat soften the getaberka here and make it by frictional heat, softening the getaberka, and then make filling to the root canal. But this technique is not good enough because it makes voids in the quality of the obturation. Now we was talking about the worm getaberka inside the root canal. Now we will talk about outside the root canal. Like we talked before the Obtura 2. The Obtura 2, we soften the getaberka outside the root canal, and then we injected into the root canal. Now we use a 23 gauge tip syringe, like this one, the ultrafill. We put the pellets here, and then we heat it, and then it comes. We heat the getaberka outside the root canal. The disadvantages is the overfilling or underfilling. We have to make sure that we are trained to use these devices. Increase the porosity if we didn't make a very good vertical compaction, and increase micro leakage. The Thermophile. The Thermophile is a device consists of the alpha phase getaberka around a carrier, and then we insert this carrier in this machine. When we insert it, this machine softens the getaberka here, and then we put the getaberka the carriers has the same size like the standard getaberka or the standard master apical file, from 20 to 140 size, and the carrier is from the titanium, or the company changed the titanium to plastic carriers. Like this one, look. Now this is a plastic carrier. They changed it because how we use these carriers. After we heat these carriers, we insert this carrier in the root canal, and then we take a burr and cut to the orifice of the root canal. Cut this handle, and we leave the getaberka with the core inside the root canal. When it was from the titanium, the core or the carrier was from the titanium, it was very hard to retreat it, and then very hard to remove. So the company substituted the titanium with a plastic one, so we can retreat the cases easily. And it's more flexible than the titanium one. The plastic one is more flexible, move easily around the curvatures. So they changed the carrier to plastic one. Thank you.